Hello, hello. Hi, how you guys doing? It is Dr. Verdialis from the Georgia office. So today, for my absolutely fabulous and youthful 40 plus ladies, I want to open our discussion forum and talk about what else can be done to improve outcomes on pregnancy and keeping pregnancies past 40. So I'm going to present a few issues and ask if there's somebody out there that has had some of these procedures done. So one, um, there's a few new things that are happening out there in terms of low ovarian reserve patients. One of them is stem cell therapy. Stem cell therapy, unfortunately, is illegal in the United States for this purpose. It is FDA approved for certain procedures only, and it's not approved for fertility. However, I do know some patients that have traveled outside of the United States and have had stem cell therapy into the ovaries. Um, I was able to get some information on it from the doctor, and I've known a few patients that have had this procedure done. And it is placental tissue, all right? So it's not your stem cells that are being injected into the ovaries, but it is placental derived tissue that is grown in the lab. Um, and so people respond different ways because it is to some degree foreign DNA. So if anybody is watching this and has that experience, I would love to hear what your experience was. I've had two patients come back into the office after traveling and getting the procedure done. And then one of them, her FSH just shoot up. I think she probably had some sort of reaction to the DNA, but it is foreign DNA. So her FSH went all the way to 40, and we were trying to, with steroids and PRP, autologous, obviously PRP, try to bring those numbers down. The clinic that performed the procedure for her mentioned that that was normal and that it took a month or two to level out. And then finally, she should start seeing regression and an improvement in FSH and AMH. But I did lose track of her. So, I'm very curious. The other technique that is being employed is a technique where they take your stem cells out of your spine, like a bone marrow biopsy, and then they go ahead and inject it in the ovaries. That makes me a little more comfortable, even though they're older stem cells. If you're going to use that technique, it is your own DNA. So that one I know by theory. I don't know of any patients. So I also would love to hear from somebody in the audience that could have had that technique done, so we can all share the experience together. The other thing that is starting to get a little bit of buzz out there is VSEL, which is kind of hyper activated plasma. So essentially, it's the same PRP. However, using certain lasers, certain light devices, you activate some small embryologic cells that are floating in the PRP, and so it's like hypercharged PRP. Um, but it's still in very early stages. It's not well known, and that's also something that I will be definitely looking into because it sounds like very exciting. It's your own PRP, which I'm already using, but kind of supercharged. So I'm expecting to see even better results than what I'm seeing with PRP, and the data on PRP is fantastic. So you can have somebody have up to a 30-40% improvement in their pregnancy rate and IVF cycles, etc. I have a patient that have had 3 intraovarian PRP, and she is 42. She went from producing 5 eggs to producing 15 eggs out of those serial PRP. I always recommend to do serial PRP. It works better. It kind of builds upon each other. The other case that I'm going to be discussing is women past menopause and what to do. I've been working with about 3 ladies right now, and they all have the same experience. One is 54, the other one is 52, and the third one is 61. She came into the office today. And it is losing the pregnancies. And what I've realized is that when you're past menopause, your uterus is not monthly bleeding anymore, and there is a level of atrophy that happens. So even though we can manipulate the uterus to build up the lining, there's something that that's happening that we don't quite understand, where maybe that uterus is a little weaker, if you want to say it that way, and it's not supporting the pregnancy past certain point. So the first lady, she's been doing better. She started this journey when she was 58. And she has been pregnant 3 times. The first one ended up in a biochemical. The second pregnancy ended at 8 weeks with the heartbeat stopped. And the last pregnancy, which happened about 3 months ago, ended up with at 10 weeks. Again, the heartbeat stopped. And so we went back to the drawing board. And so we've been doing uterine priming with monthly PRP supplements, acupuncture, heating pads, and monthly, like she's on birth control pills in order to have a period every month. And that way kind of build up that lining and get ready to receive that pregnancy and keep pregnant. So somebody says, I hear supplemented with collagen could help with the uterus expansion. Yes. So you really want to not only supplement with collagen, you really want to do something like bone broth, bone marrow, crushed bone marrow, because you want to give the precursors for your uterus for your body in general, to be able to build its own collagen and its own elastin. And what I've been doing as well is injecting the PRP into the muscle of the uterus, and also doing high volume PRPs on the postmenopausal ladies. Not only it'll stretch it out a little bit, but it'll stretch out the tubes, and then it's like I'm bathing the uterus inside but also outside. So that's what I've been doing with her, and I have noticed an overall improvement in her tissue, both on the vaginal tissue. When I started working with her, you could tell that she had been in menopause for over 10 years. And now it's like, I joke with her. I was like, wow, your vagina looks really good. So it does. It looks a lot pinker, a lot plumpier, a lot more elastic. And the resistance from the PRP is a lot less. So that's letting me know that uterus is getting some elasticity that is needed to allow that uterine expansion during pregnancy. So the second lady, so that's a 61-year-old, she's been pregnant 3 times. The second lady, she's 54. I kind of felt really bad for her. These are the 3 cases I'm describing. They're using donor eggs. And so the second lady, 54, first pregnancy ever. And she ended up having a twin transfer. And they both implanted. I would have encouraged her to do one at a time, but she ended up transferring 2, and they both implanted. And she was actually developing congestive heart failure. I talked about her a few weeks ago. And her uterus could not support the pregnancy, so she actually lost the babies at 10 weeks. So with her, I'm gonna work with her on her health. She is overweight, so I'm gonna work with her to build up her cardiovascular reserve. We're going to do a stress test, make sure that she's healthy enough to do this, and also put her, just like the first lady I was describing, on cyclic periods with birth control pills while we're doing the weight loss and also serial PRPs and the supplements and the whole 9 yards in order to improve the health of the uterus to be able to support a pregnancy past first trimester. Um, so those are things that, thinking kind of outside the box and what else can be done. I know that the other thing that's coming to vogue as well, it's IV infusions. So IV infusions, we do it at the office, where we call it the immune boosting, but it actually is kind of anti-aging because it has the IV vitamin C, it has B complex, it has calcium, magnesium, zinc. It also has glutathione, IV, and NAD, which is an anti-aging. It's normally an antioxidant that is it also helps with in the mitochondrial. I'm sorry, I was like reading somebody's note. Alrighty, so Miss Erica, how come CNY never talks about people with thyroid problems? Takes it more seriously. I'm very, very surprised that you feel that way. We're pretty obsessed with the thyroid, and we take it extremely seriously, especially when there's no real reason for you to have thyroid issues. And that's one of the reasons we're very adamant about the diet that we put people on. Especially gluten tends to stimulate an autoimmune reaction with the thyroid. So if you've heard any of the like Dr. Kills and myself, actually Dr. Kills take it to the next level. I mean, for him, plants are the devil. So, but plants tend to have a lot more antigens and stimulate autoimmune reactions in the different glands. So we do recommend a grain-free diet. Gluten, wheat, corn, soy, oats, rice. The lowest carbs is going to be really good for your thyroid. I usually will put my thyroid people on some form of low dose iodine. We check the thyroid on a regular basis and treat it, because thyroid is associated with fertility issues, and we tend to keep people in the lower range of normal. Also, if you're having premature ovarian failure due to hypothyroidism, it's probably autoimmune. Autoimmune issues come in families. So, and that's another reason why we're really, really big on reproductive immunology, because a lot of endocrinological deficiencies are actually autoimmune. So, you're always welcome to reach out to me if you want to talk about your particular case and what else we can do for you. All right, so my ultrasound today, my lining is 12. I want to do a frozen transfer in this cycle. All right, so so Maida, is your baseline lining at 12? That's very thick. Because 12, it's good to do the transfer. So we like to see the lining. I would say 10 is like the magic number. Minimum is 7, and maximum is like 13, 14. So 12 is like still good to do your embryo transfer. So if you are on baseline, we would have to see how the rest of the labs look. And then you might have to switch to progesterone to start for you to do that embryo transfer. Sometimes when I see people respond very robust to the estrogen, like for example, somebody that comes in and their lining is already like 7 and they're already done with their, with their heavy period, with the heavy part of their period. And then in 2 days, their lining is, 15. They can do a modified natural or just a straight natural cycle, and they do better. Actually, I have a patient where she just super overreacted. She just her 2 days of estrogen, and it would just get super thick. We ended up doing a few endo scratches just to try to get her lining to be thin at the beginning. And she is now the proud mother of a girl. And the cycle that functioned for her was actually a natural cycle. We did not give her anything, no letrozole, no nothing. We followed her and triggered the follicle that she had created. And then that was the cycle that helped her get pregnant. But she had a bunch of like cancel cycles for, the lining being too thick and so forth. So yeah, anybody out there past 40 that has had some like really out there experiences, um, with like new technology. There's another one that is getting a lot of vogue. One of the acupuncturists up in Syracuse is huge. Is like the infrared light, especially around the abdomen. There's some stuff that there's some, I don't want to call it literature, but there's some gathering of data showing that it'll penetrate and stimulate anti-aging in the ovaries. So you can put like red light and infrared, especially infrared light around your pelvis, to help those ovaries work better, and the uterus. I mean, the whole area is going to be improved. Okay. There's also something called a med bed. I had the opportunity of being exposed to it. It's based on like Tesla coils, and supposedly it stimulates your own stem cells. And I don't have enough information on it, but it's definitely out there. Cool. So you also bought some red light therapy belt. So there's a lot of different machines out there in terms of red light and infrared light. I like when they combine it, when you have the pad that is both infrared and red light. And everybody Googles and gets in YouTube. There's a lot of videos out there. There are books on it. So I'm just putting it out there because I know we are trying to push the envelope on this age group, and sharing is caring. So another thing is the acupuncture. You've known that, but acupuncture with electricity, for example, is another big one where they connect the needles to wires and then actually send signals. There's also acupressure with tuning forks. It's again, I'm just adding a few of the techniques that are out there that could help women past 40, change their lives. In my experience, it is when you do all of it. It's when you try different things. Of course, some will work better for some people and others, but but definitely, it's when this one adds a little bit and this one adds a little bit, and you have the supplements and you have the PRP and you have the IV infusions and the diet, and suddenly at one point that balance is going to tilt in your favor. Okay. Very good. All right. Well, so somebody's talking about good results with red light. Yes, I have a red light machine for myself. I love it. I mean, I could be better about it, but I'm sure a lot of you guys would say the same. But it's good for even for like your skin tone, anti-aging. Sometimes even when you have like a tummy ache, you put that infrared on the tummy, and it works wonders. It also helps with leaky gut and pain management. Okay, so around the joints, the back, it's really really good. Okay. All right. Well, it's been great chatting with you guys tonight. For those of you that will be um, joining, yep, I can definitely talk about before we leave. Can you talk more about the theory behind putting older women on lower doses? Are there studies about this? Yes, they are. There's definitely studies about this in the National Library of Health, and less is better for older women, and I'll explain why. Because your ovaries, they are whatever your age are. Okay, that doesn't mean that you have bad eggs. That doesn't mean that you have bad ovaries. You have older ovaries. So the gentler you want to do. You want to allow them to work at their pace. So when you push them too hard, you might end up with a few more eggs, but they tend to be less quality. And we're trying to get quality over quantity past 40. There's even a study, we have switched as a company to lower dose and adding the letrozole, because again, the letrozole was found that it really helps in terms of the quality of the eggs and then higher pregnancy rates. Because at the end, it's not a competition on getting as many eggs as you can. It's actually getting a baby home. So I'd rather we stimulate you longer and gentler, and maybe we don't get 8 eggs and we end up getting 5, and then out of those 5 that they were able to do all the cell division that an egg needs to do, which is two rounds of meiosis, that it's able to do it correctly. And then you might end up with 5 eggs and maybe 2 embryos, but then out of those 2 embryos you take a baby home instead of 8 eggs and 4 embryos, and 2 die on the second day, and then you end up with 1 embryo. Okay. Okay, so I'll answer 2 more questions and then we will continue on our adventure. Alrighty. So failed transfer with normal embryo. Yes, there's a lot of data showing that PGT testing is not really as good as we think it is, because it can damage the embryo and therefore cause implantation issues. And there are a lot of abnormal embryos that self-correct because it's such an early stage in evolution that the cells might die on their own. The ones that get biopsy actually might die on their own, and then the good ones take over. So I generally don't recommend you're past 40 and trying to get pregnant. You're already taking a leap of faith, so just take it all the way. At this stage, everybody's freaking out about chromosomal anomalies. The reality is that most chromosomal anomalies are not compatible with life. So what you get is either failed implantation or early miscarriages due to chromosomal anomalies. Everybody's like terrified of that, and it's not as common as you think it is. Okay. All right, people. It's always a pleasure. So I will be stopping this adventure, this evening adventure right now. For those of you that will be joining me on Friday on the V celebration event, I will see you there. And for those of you that can't make it and would like to make it, I'll send you love from a distance. All right. So I'm back on Facebook tomorrow for the Spanish crowd. And then I will see you next Wednesday. Bye-bye.